Hi everybody, it's me, Dr. Gonzalez, and one of the questions I get asked all the time is saline, silicone, gummy bears, what's the difference? Which should I have is the right thing for me? So saline is the one we use probably most commonly. That's what you see here. This is an empty saline implant, and this is how they come. We remove all of the air, we roll them up, we slide them in through an incision, and then we fill it up with snowball saline. It's the same stuff that goes through your IV bag if you see people getting IV fluids. A silicone implant, or often referred to as a gummy bear implant. A lot of times in the past we've talked about silicone implants, or you may have come across some research when you're looking at it online and you hear something maybe bad about silicone implants. And those are a long time ago. Those implants where if you had a leak in that implant, it oozed out kind of like a silicone gel. And some people were made to believe that may cause some adverse consequences for them or get into their bloodstream. The good news is these new implants don't do that. Technically, if we cut them in half, that cohesive silicone gel actually stays inside there, so it doesn't really have any chance to circulate and move around the body very well. And that's kind of how they get the term gummy bear. It's not a really official term. But gummy bear and silicone or cohesive gel implants are what we use. I prefer silicone implants for patients who have very thin tissue around their breast. And the reason I prefer these for them, or I usually recommend these for them, is I tell them that silicone tends to have a more natural gel feel to them, and there's a little less issues we have with rippling compared to saline implants. Really, they both actually aesthetically will look pretty much the same. The only difference is silicone a little more likely, or rather less likely to ripple. If you have any more questions, you know how to find us. Come by and give us a visit for a free consultation.